Good morning. Saludos, abrazos, everyone. Thank you for joining us. And basically today we have this event where we're going to present the latest COVID-19 data, including on years of potential life loss, something that really we have to start talking more about, that emphasizes the need for additional investments in Black and Latino communities. Today's event will include analysis of public health data from several medical experts, followed by a discussion on the economic, educational, housing, and social implications and the imperatives of unity. Very important, organizing, unity, working together to address COVID's larger community impact. I am Xavier Nogueras. I am one of the co-founders of Illinois Unidos. Illinois Unidos is a consortium of over 100 health professional community-based organizations, elected and appointed officials that aims to present one united voice. We started about a year and a half ago, and with the great help of Latino Policy Forum, Illinois Unidos has grown into a national model of how the community can get together to address many of these issues and really tell our own narrative. And we want to definitely thank Latino Policy Forum. We want to thank and welcome Chicago Urban League Networks, all the folks from Illinois Unidos, all the Acuerdo networks who are here, and our partners, our stakeholders, but especially we want to thank our health professionals. We have many today really talking about some of this really new data that we have to really start looking at when we talk about years of potential life loss, and we really start talking about long haulers. Basically, our agenda today, we're going to have a presentation, some slides, and we are going to have our panelists. I'm going to do that introduction of our panelists in a second. But before we do that, I do want to already introduce one of our panelists who is going to be our first presenter, and that's Dr. Melissa Simon. Dr. Simon is the George H. Gardner Professor of Clinical Gynecology, Vice Chair of Research in the Department of Obstetrics and Gynecology, Vice Chair of Research in the Department of Obstetrics and Gynecology at Northwestern University Feinberg School of Medicine. She is also the founder and director of the Center for Health Equity Transformation and the Chicago Cancer Health Equity Collaborative. Dr. Simon is co-chair of our very own Illinois Unidos Health and Policy Committee. She has been recognized with numerous awards for her substantial contribution to excellence in health equity scholarship, women's health, and mentorship, including her recent election to the National Academy of Medicine. Congratulations on that. Thank you so much for your time today, and I will pass the mic to Dr. Melissa Simon.
Thank you so much for those very kind words, Xavier. I really appreciate it. And thank you to everybody for joining us today. I want to go ahead with the slide presentation view, please, if you can change. Thank you so much. Okay. Next slide, please. All right, so I'm going to just give a quick overview of where we're at with COVID and some new ways of looking at the data and the impact on Latino and Black communities across Illinois and Chicago, because it's really important from a health equity perspective that we actually look at the data in ways in which it really highlights the devastating impact. And if you don't really look under the hood of the car and really look at the data in these different ways, then you aren't going to get the real picture, and you're not going to be able to align practices and policies to help improve that picture for everyone and not leave any population behind or any community behind. So with COVID-19, the community transmission across the state as of a few days ago is still predominantly high transmission across almost every county. So across 94 counties of the entire state of Illinois, we are still in high transmission rates. It is, and that is not good, despite the fact that we have COVID vaccines that will prevent contraction of COVID and prevent transmission. Only 7 counties are in substantial transmission, and those are the orange ones on the state picture there. And then there's 1 county that has moderate transmission. There is not 1 county in this entire state that has low transmission. Next slide, please. The daily case rates for COVID-19 per 100,000 people in Illinois. This is a picture from across since the beginning of the pandemic. On the left, you start with February of 2020 and moving to the right. And what's important on this picture is that you see on the very far right where that little red circle is, the 7-day average new cases, 4,449. And that's of November 19th for the state. That again, it just shows you that we're on an uptick of an upswing of cases, and that is concerning for another surge. So masking, distancing, testing, and vaccination remain the important things to do. Next slide, please. These are the rates per 100,000 of newly diagnosed COVID cases for the state. And this is a snapshot of what's happened so far in November. And this is by race and ethnicity for the state. And I want to thank Dr. Noreen Sugru from the Latino Policy Forum for pulling this together for us. Basically what this is saying is Black and Latino communities are continuing to have high new diagnosis of COVID cases. Now, this could also include people who have had COVID before and got COVID again, because as we all know, you can get COVID again, even though you got it once earlier on in the pandemic. There are different strains going around, and it is important to note that that's why vaccination is so critical. Next slide, please. Now, these are for Chicago, but the data also mirror the overall state of Illinois trends. And I received these data from the Chicago Department of Public Health's website, their dashboard. And basically what it's saying is if you look on the left circle where there's under cases, you see ages 0 to 17 and 18 to 29 and 30 to 39. Those are the ages across race and ethnic groups that have the highest number of cases. And those contribute. Now, if you follow your eyes with that red arrow to the right circle, you can see hospitalizations and deaths column. And those are in the older individuals. So those are in the 50 to 59, 60 to 69, 70 and older column individuals. And those cases are of the younger, because the younger populations in our state are less vaccinated across race and ethnic groups. They are impacting and driving the hospitalizations and deaths of the older adults across our state. So what's really important here is because a lot of Black and Latino communities are living in multi-generational households with the younger and older people. And so workplace, school exposures continue to be an issue with spreading and transmission of cases from the younger to the hospitalizations and deaths of due to COVID-19 of the older. And again, COVID-19 is a preventable disease now. It's preventable with vaccination. Next slide, please. This is just a snapshot of weekly change in cases by race and ethnicity and age. And just to give you a little flavor, I want to thank Margarita Reina, who's a senior epidemiologist in the Department of Public Health in Chicago and a wonderful member of our team of Illinois Unidos. And she has done an amazing job with providing us with data on a weekly basis. And so if you look at the purple circle, those are Black non-Latino people who have by age, in the 0 to 17-year-olds and the 18 to 44-year-olds, you see the increase in change of 72 cases and 84 cases in a 1-week period of time. So in those age groups in the Black population, 0 to 17 and 18 to 44, the cases are going up remarkably by week. And the same thing, if you look to the right in the light blue column, the Latinos population, if you look especially in that 18 to 44-year-old range, which is the blue circle I have on the chart, they're going up as well, really high every week. This is a data snapshot from week to week change. Even in the white population, the white non-Hispanic or non-Latino population, 18 to 44, the data, again, the cases are going up remarkably with 140 increase in cases in 1 week. Again, COVID is preventable. Next slide. This is the deaths. So let's look at deaths across Illinois since the beginning of the pandemic. That's in the gray graph on the left of your screen. And if you look at that little red circle again, November 20th, November 19th, there were 42 deaths due to COVID on November 19th alone in Illinois. And if you look to the right, that little blue bar chart is a snapshot of October 24th to November 19th of all the deaths in Illinois per day due to COVID-19. Almost all of those deaths in this little 1 month or 3 week period of time were preventable, almost all of them. We have way too much blue on this bar chart. And so we really have to do something about it. Next slide. So when you look at these data with respect to age, people are dying. There's an even bleaker picture. So this is what I mean by looking under the hood of the car and really looking deep into the data. And so one thing that epidemiologists do is we calculate years of potential life lost. YPLL is what it's called. And it's basically an estimate of premature mortality. It's an average number of years a person would have lived if they had not died prematurely. So if you die at age 20, then we would look at the data and we would subtract it. We usually use age 65 as that mark, and we would subtract 20 from 65, and that would be the gap, the premature mortality. Okay, so if we look at the data for Chicago, next slide. This is provided by Margarita Reina, again, our senior epidemiologist from the Chicago Department of Public Health. So if we look at the years of potential life lost by race and ethnicity for Chicago, this is for Chicago. The trends for Illinois are similar. The Latino, Latinx, Latine community, the blue bar again. If you look all the way to the end of the chart, 2,845.3 is the years of potential life lost or premature mortality due to COVID per 100,000 population through October 26th. If you look at the purple bar, Black, non-Latino, all the way to the right, again, similar and very, unfortunately, very high. 2,695.6 per 100,000 population. And then the gray bars underneath each of these blue and purple bars are the COVID-19 deaths. So through, again, October 26th. So the impact, so just talking about numbers of people who've died to COVID is not enough. What's happened is that our younger Black and Latino populations have died at a younger age, and that contributes to potential years of life lost and very harsh reality of devastation. Next slide, please. There's a devastating socioeconomic shock to our Black and Latino communities in Illinois, and the impact this blow will have to economic resilience of Black and Latino communities will be long lasting and will require intentional and strategic investments that our co-panelists are going to talk about soon. Many of our Black and Latino children in Illinois also have lost at least one primary or secondary caregiver, almost all, and that is extremely devastating and impactful to mental and physical health and to also the economic resilience of each individual household and then of the whole communities. The impact of long COVID symptoms, because people who did get COVID or continue to get COVID actually have a high chance of having the long COVID or the long haulers syndromes. And those also have mental and physical health impact in addition to people who've lost loved ones as well. And that creates a disproportionate severe toll on Black and Latino families and communities that we cannot ignore. Next slide, please. So to hit the point home, vaccination is critical. We are not out of this pandemic yet, not even close. And, you know, I know a lot of data show first vaccine completion, but the real number is those who are completed the COVID-19 vaccine. And if they're 6 months out, it's actually the booster now, because we know that all adults should have boosters as well if they're 6 months out from their second dose of the completion of the vaccine series. And so this is by race ethnicity as of November 18th, data from Illinois Department of Health. And these are the bold percentages that say that are next to the word Illinois. Those are the Illinois rates for completion of vaccination. And so Asian non-Latino population has the highest completion rates of vaccine. The number underneath the Illinois non-bolded percent, the 66.7% is the Chicago number. For Black and Latino populations, Again, for Black populations, it's 44.7% have completed their COVID vaccine series. So we are far from being done with pushing different programs and different approaches and different strategies to get people vaccinated. And same with Latinos, 49.8% at the state level have completed their vaccination rate. We have a lot of work to do. You know, in the country, there's 40% of people not completed their vaccine yet. And we also have this group of people who have completed their vaccine and haven't gotten the booster yet. And so what's gonna happen there is it's gonna cause more, that upsurge that I showed you earlier on in the first slide. So last slide, please. I'm going to hand it over now to Xavier to introduce our panelists. Thank you so much.
Thank you so much, Dr. Simon. That information is so critical. Some of it we know, but some of it is new. And this is why this event is happening today. Just some housekeeping stuff. I forgot to let everyone know. Leave a question on the chat. We are going to have some time later on to go over some of those questions. The webinar is being recorded and is going to be available later on. That's it. So I just wanted to let everybody know that. Also, the webinar is being translated in Spanish. We have an incredible panel. So proud to be I'm here today with this panel. They have changed the way equity is viewed and acted on, not only locally, but nationally. They've also helped shape strategies locally and nationally, and they have just had an incredible impact. And I'm just going to quickly read off and introduce our panelists before we get started. First, I want to welcome Dr. Marina Del Rios. Many of you know her. She was the first person to receive the COVID-19 vaccine in Chicago. Is an emergency physician with over 16 years of experience working in tertiary care hospitals, serving marginalized communities in New York, Chicago, and now Iowa City. She's an associate professor in the Department of Emergency Medicine and research faculty at the University of Iowa Carver College of Medicine. She's an active member of the Puerto Rican Agenda's Health Committee and serves as chair of the Health and Policy Committee of Illinois. And like we always like to say, she is the soul of Illinois Unidos and has been an incredible voice at Illinois Unidos. Dr. Wayne H. Giles. Dr. Giles is Dean of the Public Health and the University of Illinois at Chicago. Thank you for being here today. He is part of the only accredited school of public health in the state of Illinois. Prior to joining UIC, Dr. Giles spent 25 years at the Centers of Disease Control and Prevention, where he led the Division for Heart Disease and Stroke Prevention, the Division of Population Health, and the Division of Adult and Health Community. Welcome. Welcome, Dr. Damon Arnold. Dr. Arnold is a medical director in the Special Investigations Division of Blue Cross Blue Shield of Illinois, Montana, New Mexico. We're working in Montana, New Mexico, Oklahoma, and Texas, as well as the Illinois Medicaid and Medicare government programs. Previously, Dr. Arnold was the director of Illinois Department of Public Health from 2007 to 2011. Dr. Arnold also served for 26 years in the Army National Guard as the commander of the Illinois State Joint Task Force medical commander and as a qualified Black Hawk helicopter flight surgeon. Wow. Colonel Arnold served 2 tours of combat duty in Iraq as well. Among his military medals and recognition, he was awarded the highly coveted Legion of Merit Medal by President Barack Obama. Wow, thank you for being here. Karen Freeman-Wilson. Karen is the president and CEO of Chicago Urban League. Many of us know her, know the work of the Chicago Urban League. Karen brings a passion for equity and social justice to her role as president and CEO, and has served in the public and nonprofit sectors most of her professional life. She was the first woman to serve as mayor of Gary, Indiana, and the first African-American woman to serve as mayor in the state of Indiana. Freeman-Wilson also served previously as Indiana Attorney General, director of the Indiana Civil Rights Commission, and presiding judge of the Gary City Court. Wow, thank you for being here, Karen. My good friend Sylvia Puente. Sylvia is the president and CEO of the Latino Policy Forum. Over more than a decade at the helm of the forum, Puente has grown the organization into a central voice on Latino issues and has established herself as a thought leader in the arena. Sylvia's leadership guided the forum's response to COVID-19's disproportionate impact on Latinos and communities of color by securing economic assistance for hundreds of affected families, of advocating for them in conversations with city and state leaders and nationally, and compiling data, information, and resources for its Acuerdo partner network of over 130 local organizations serving the Latino community, which the forum convenes among other efforts. We have already introduced Dr. Melissa Simon. Thank you once again for being here. And Dr. Geraldine Luna. Dr. Geraldine Luna is a medical director for the COVID-19 initiative at the Chicago Department of Public Health, executive board director at the Medical Organization of Latino Advancement, MOLA, chair of the financial committee of MOLA, and clinical assistant professor faculty at UIC. She is also double board certified in geriatrics and internal medicine. Additionally, her passion for health equity and social justice for the underserved and marginalized community of color in Chicago moves her to actively partake in community advocacy as a member of Illinois Unidos Partnership and the People Response Network COVID-19 National Initiative. Her research work is on minority health and equity. I know I said a mouthful there. This is an amazing panel. Thank you all. And we're gonna jump right into the questions right now. And so the first question I have is for Dr. Del Rios. Dr. Del Rios, how are you?
Good morning, Xavier. Thank you for the introduction. Happy to be here.
Thank you. You know, there have been many Latino and Black adults who have been infected with COVID and have recovered. But we know now that there have been many individuals who are recovering from what is called long-term COVID. Can you put into perspective what this data means for our Black and Latino community and how it will affect their future and families' future?
Sure. I mean, I think that the main point here is I worry about this persistent narrative that proposes that because COVID-19 mortality rates are low, that there is no need to continue stressing about preventing COVID. First of all, we know that that narrative is not true. Dr. Simon just summarized the evidence and how COVID has had a disproportionate mortality effect in our communities. But we also need to talk about that there's a difference between surviving and thriving. Dr. Simon just talked about years of potential life lost. I propose we also need to start a discussion on years of productive life lost. We know that COVID has multi-organ manifestations. People that have been infected with COVID, up to 70%, can have persistent symptoms that go beyond the acute phase of COVID. These symptoms can be fatigue, persistent loss of smell or taste, but some are more serious: renal failure, myocarditis, long-term effects from stroke, neurological syndromes. COVID-associated thrombosis can lead to clots in the lungs or in the brain. And they can also there's a lot of people that end up with pulmonary fibrosis and persistent difficulty with breathing. This post-acute phase of COVID, which is now widely known as long COVID or long haul or post-acute sequelae of COVID, has been reported not only in patients that are admitted to the hospital that may have been in the intensive care unit and ended up with some long-term effects from that, but it's also being reported in children and even in adults that had milder disease. So, and all of these symptoms can end up affecting your daily productivity and even your capacity to do your normal daily activities of living, whether because of breathlessness, because of fatigue, because of muscle weakness, because of impaired concentration. A lot of people left with anxiety and depression post-COVID. And so from a societal standpoint, we really need to prioritize investment, both to study these long-term effects in our communities, but most importantly, to invest in all the families that have been affected by COVID in the long term, not just the ones that have lost loved ones, but the ones that are now left with loved ones that are unable to return to their previous job because of disability that has been left due to COVID, or also to the children that may now be left with long-term learning deficits or even long-term disability as they return to school. So I think one important part of this discussion is really calling for equitable investment to measure these long-term COVID effects, to design and implement culturally competent and language concordant interventions to mitigate these long-term effects, and most important, to continuously evaluate so that we ensure that equity remains as our primary outcome measure. The bottom line is surviving COVID is not the end point. We want to see our communities thrive.
Thank you very much for that, Dr. Del Rios. Dr. Damon Arnold, how are you?
Doing fine.
Thank you for joining us today.
I was trying to turn my video on.
Thank you so much. Latinos have the highest number of uninsured rates nationwide. Being someone who works for an insurance provider, can you speak to what years of potential life lost data means to you and talk about efforts being taken from a private insurance perspective to address it?
Oh, sure. I'm not I'm speaking on behalf of HCSC, who I'm working for, Blue Cross Blue Shield of Illinois. But my perspective is that there are so many things that we should be doing, and it speaks to a lot of the things that were said earlier. One of the things is making sure we take care of our health so we don't become sick in the first place. The most effective way for people to protect themselves financially and from a healthcare perspective is to get fully vaccinated. That is beyond anything that anyone can contest, or that idea that getting vaccinated is not needed, needs to go away. People who are hospitalized and are put on ventilators have an average cost of about $140,000 from the care they receive over a 3 to 4 week period while they're being hospitalized. That has a devastating economic impact on the family. So the ACA actually is a great step forward. We have that in place, making sure people take advantage of what is available now. And for those people who are getting older like myself, which happens to be the group that was most deeply impacted by deaths and hospitalizations, making sure that you look at things like Medicare Advantage programs, making sure you select the one that's correct for you. But the insurance industry has been given, millions and millions of dollars away for, giving the kinds of care, covering the vaccinations on a massive scale across the country, and then also participating in vaccination campaigns. What we do need is to make sure that we have representation and we protect ourselves, in the global market for insurance, and make sure that you have a voice at the table when legislators are making decisions that are going forward. But I think that there are many things that people can do to protect themselves. And this goes back to chronic diseases before even the pandemic. We have to make sure that we're not living the kinds of lives that leads to heart attacks, to strokes, and also to acute respiratory illnesses like the flu. So even getting a flu vaccination is important, making sure the kids are fully vaccinated before they go to school as well.
Thank you so much, Doctor. Dr. Geraldine Luna, how are you? Thank you for joining us.
Hi, how are you?
Abrazos. Dr. Luna, the years of potential lost life data shows a daunting reality that we've lost many people from our Chicago Black and Latino communities. Can you talk about what the city is doing to address the loss of these lives, and also what are some of the city initiatives and efforts currently going on?
Of course. Thank you. Thank you for having me. The city of Chicago has been the equitable access to our communities has been the heart of all our initiatives. And this crisis, COVID-19 crisis, as well as those very disparities that we had before, have been addressed and have been the initiative moving and the engine moving every single aspect of our initiatives here in the city. For example, we start with Protect Chicago Plus, which kick off February, focusing on our 15 communities highly impacted by COVID-19 based on a vulnerability index. During the early stages of Chicago COVID-19 vaccine rollout, the city was building capacity to support communities, providing access to the areas most needed. And as a result, from February to early May, individuals with at least one dose of COVID-19 vaccine, the initial community went from 6% to 50%. And before we end this next upcoming week, Thanksgiving, we are expected to achieve 77% of all citywide communities at least having one dose of the vaccine. So that is our expectations. We still are working very hard for those communities that have lower vaccination rate. So Protect Chicago Plus evolved And it became, it provided this partnership with communities organization to have canvassing teams, because we know trusted faces in our community is so important. Like the messenger is as important as the message. And creating those relationships were so necessary for the city. So now we have city vaccine ambassadors knocking on doors. And from August 14, our canvassers have knocked more than 12,000 doors, providing and requesting and retreating that information that we understand that our communities are keeping our families from getting those vaccines. So 56 of our 60 zip codes have at least 50% of their residents age 12 and over that has received one dose of the vaccine. For example, 60636, which is Inglewood and West Inglewood, saw the biggest increase of the first vaccine doses coverage last week and the last month and the week before that. Early this summer, CDPH also announced the department is allocating $9.6 million in COVID-19 relief fundings from the CDC to establish Health Chicago Equity Zones, which are 6 geographic areas covering the entire city and will be led by regional community organizations, again, working with partners, trusted faces in the communities to reach out to the population need, especially those that need it the most. Relying on participatory, data-informed processes, these organizations will create community-based stakeholders coalition to first focus on vaccine promotion and also develop targeted strategy to improve community and in individual wellness long-term. So we're talking about mental health, violence, domestic violence, programs, initiatives, picking up our children, bringing them back to systems that we can train effectively our children, keep them safe, practicing sports, arts in the community. The Healthy Equity zones is an extension of the racial and health equity work implemented by community leaders, public health entities, city governments, and health institutions who crafted Chicago's equity COVID-19 response strategies, including the city's racial equity rapid response team, which is a big number of individuals of all our organization, community-based, embedded in our communities most highly hit by COVID-19, and that they have the high disparities in the city to work all together to pick our communities and give everybody equal chances to thrive in the community. Also, earlier this summer, CDPH released the State Health of Blacks in Chicago, a first-kind data brief describing the health status of Chicago Black population and the root cause inequities disproportionately affecting the life of Black Chicagoans. The brief provides a deep look at top drivers of life expectancy gap between Black Chicagoans and non-Black Chicagoans, which is 9.2 years and rising. The COVID-19 also brought to the surface these inequities in our city. And in 2020, CDPH launched the Healthy Chicago 2025 is a citywide plan to reduce the racial life expectancy gap with strategies to tackle the root cause of health. The department also recently hired the first chief racial equity officer and uses its Healthy Chicago survey and City Health Atlas to better connect the Chicagoans and make more data accessible.
Thank you. Thank you. Thank you so much, Dr. Geraldine Luna. We appreciate you and appreciate the information. Thank you so much. Now we're going to move on to Karen Freeman-Wilson. Thank you. How are you? Karen? Okay, we will wait a second for Karen to jump on. We are going to move on to Sylvia Puente. Sylvia Puente, how are you doing?
I'm on.
Oh, you're on, Karen?
Yes, Sylvia.
Karen,
Sorry about that.
How are you? No problem. Thank you for being here. From a community perspective and the need for additional investment, can you talk about what this data means to the Black community? Specifically, can you talk about what the work that Chicago Urban League has done to elevate the impact of COVID in the Black community? And while you're doing that, address the importance of getting vaccinated and give perspective on where the Black community is and when it comes to vaccine hesitancy.
Absolutely. First, I want to just thank all the partners for the opportunity to join you on something that is clearly extremely crucial to the Black and Latino communities throughout the Chicagoland area, and to really highlight something that hasn't been talked about a lot, and that is life potential, the impact that COVID is having on the ability of people to really realize their greatest potential. And we know that there are many barriers, but to really single COVID out in this way. And when I listen to the statistics that we've been talking about today, there are a few things that come to mind. First, that there is an intergenerational impact of COVID that is really underscored when you look at the number of younger folk that are dying from COVID, that continue to contract the disease. And it really sends a message that we have a lot of education to do and a lot of information to provide to younger people, and quite frankly, a culture to break through, because they are part of a generation who believe themselves to be invincible. And so COVID is no different in terms of their thinking that I can't get it, or even if I get it, I can't die from it. And so that really does tie into the work that the League does, because we have come up with really, I'd say, ways to communicate with folk that speak specifically to this culture. Memes, using memes that really underscore some of the myths. I talk a lot about the myth of the chip that people believe is being inserted through the vaccine. And forget the fact that that seems outrageous as an idea, right? Let's talk about the fact that you carry a bunch of chips in your hand every day. So if somebody wanted to track you, if somebody wanted to, people do track you, but you are a willing part of that tracking through your utilization of cell phones and other electronics. And so, let's assume that they are inserting a chip. Well, you use a chip yourself, multiple chips every day, but we all know that that seems unreasonable. But in addition to the conversation, we use memes, we use cartoons, we use discussions that are led and that are done by our young people. We use celebrities because we know that people listen to athletes. They listen to actors and actresses. And so we utilize them to deliver a message that, that older people might be more inclined to receive just by reading the newspaper and other information. We utilize social media very heavily because we understand that a lot of younger people are on Instagram, are on Facebook, are on other forms of social media. And so we use that a lot because we understand, again, you have to meet people where they are. And the underlying message is very simple. We don't need another barrier to prevent us from achieving our potential. And to the extent that we now have a vaccine, to the extent that it is widely available, we don't need a barrier that we are creating on our own because we refuse to access what is available, and we don't take advantage of the vaccine, and we don't believe that it's important. The last message that we give, and that I will share just in discussing this challenge, is if you won't do it for yourself, because very often, even if you don't live with your grandparents, your older aunts and uncles, older relatives, there is a lot of interaction. There's a lot of contact on a weekly basis. Do it for them, because the last thing you want to be is the individual who brought COVID into older relatives that ultimately ended in a fatality to them because they were more susceptible because of underlying conditions. And I just want to address the earlier comment about underlying conditions, because it really does speak to the not just the morbidity, but the fact that Blacks and Latinos contracted this disease at a much higher level. We have to utilize this conversation as an opportunity to invest in some of the underlying conditions that made us all more susceptible to COVID-19, to invest in hypertension, to invest in diabetes, to invest in other heart conditions and care, to invest in respiratory care and respiratory diseases, and not just in the treatment, but in prevention, in research, in those things that will make it less likely that we will become more susceptible or be more susceptible to the next pandemic. So I'll stop there.
Thank you so much. Thank you. We appreciate those words. Dr. Wayne Giles, how are you doing?
Doing very well. Thank you for having me on the panel today. I'm really enjoying the conversation.
No, thank you. You know, COVID-19 is arguably the biggest public health crisis of our generation. From a data collection perspective, can you talk about what is being done well to address the reality of COVID's impact on our Black and Latino communities? And while you're answering that, what do you think is not being done well? And how else should we be looking at COVID data to give us a full understanding of its impact?
Thank you for that question. I think it's a really important one. You know, for all too long, many of our communities have been invisible. And I like to say what gets measured is what gets done. And that's why data is so important. And I think Dr. Simon's presentation really illustrated all of that well. And I love the theme of trying to get under the hood, because I really think when we look at this data, we really need to do more to get under the hood. And I think our colleagues at Chicago Department of Health and the state have all done amazing work. What I think we've done really, really well is the ability to turn around data, particularly related to COVID, very, very quickly. We now know many people in the community, and myself included, are checking the state and the city dashboard, you know, on a weekly or even maybe a daily basis. And seeing that up-to-date data has been an amazing feat. And I think it's really shown how, how public health has really stepped up in a really nice way. The other thing that I think has really been impactful has been how we've been able to show on the dashboards that local data, that data at the zip code level, so you can see sort of what's going on around your community. And that, I think everyone needs to be applauded for that. I think what we're not doing quite so well at is that I think while we can show data at a zip code level, people want data at an even more, what I like to call hyper local level. So they want to know sort of in my community when I'm looking, you know, what are the census tracts or streets where we really need to push on vaccination so we can really target our interventions to be much more effective. The other thing where I think we need to do better at is we need to realize that COVID is not the only epidemic facing our communities, but we're also having epidemics of evictions, poverty, substance abuse, overdose deaths. CDC just came out with a report last week on 100,000 overdose deaths as well. And, you know, someone put in the chat about hypertension and underlying conditions. Dr. Arnold also talked about the importance of having those underlying conditions controlled. But we need to do a better job of articulating the simultaneous epidemics that are occurring in our communities. And I think that's important, one, because I think it helps makes the case for vaccination and why vaccination is important, but it's also important because it's get us thinking about what are the holistic interventions that we need so that we are addressing the root causes of these multiple epidemics that are occurring, because we want all of our communities to thrive.
Thank you so much. I really appreciate that. Thank you so much. Sylvia Puente, how are you doing?
Good, I'm coming on now. Thank you.
Problem.
Thank you.
And we're okay on time. We may cut some of the questions. Maybe we'll go a few minutes over, but we're doing okay. This is a really important conversation. Sylvia, we've talked a lot about what these data means from a medical and health perspective. Can you talk about the implications for the Latino community from a mental health, economic, workforce, education perspective, and what are the policy implications for the Latino community, and what does this mean about investment in the Latino community?
Yeah, thank you, Xavier. And let me just extend my thanks once again to all the panelists for this amazing dialogue that really focuses on the impact of COVID on our Black and Brown communities. And Xavier, if you will, let me take a second. We titled this panel Years of Lost Life. And I want to underscore the chart that Dr. Simon showed earlier, just to reiterate the point that between our Black and Brown communities, we are losing 5,000 years. Those 5,000 years together for every 100,000 Blacks and Latinos in our city of Chicago. Those are lost lives. Those are families that won't be celebrating Thanksgiving together. There is grief. There are mental health issues, needs, and concerns. And I don't know if you can see me, but I'm putting my hand over my heart. And I just want to take a moment to breathe that in and offer a moment of silence and respect for all those families and all of us who have been impacted by this crisis. Yeah, I was feeling that and just felt I needed to say that. A lot of lost lives. But to the point, you know, and we're happy that the Urban League has joined us in this conversation as we think about investments that need to come into our Black and Latino communities. And Dr. Giles was also just saying this is more than a pandemic and all the other health issues that have been exacerbated by this crisis. But what I want to underscore is that this is more than just a health crisis. And what we have seen, particularly for the Latino community, are some really devastating impacts in education, in unemployment, and the need for mental health. And just to share a little bit of data, Deborah Santiago from Excellencia in Education, a national organization, and also data from the National Student Clearinghouse, says we are losing, we have seen 5 years of educational growth lost in terms of our students' ability to go to college. We all know that college access is not the only way, but is one way for wealth, mobility, and having a better economic future. Between 2019 and 2021, we saw Latino college enrollment decline by 7%. It's down by 13% for those that are enrolling as freshmen, and it's down by 16% for those that are enrolling in community college. So what this means is that when and how will these students ever get back to school? They have left school to help support their families because their families have lost loved ones, because their families are in economic crisis, right? We are losing their ability to economically succeed, and it's going to be much more difficult for them to complete college. With respect to K-12 enrollment, what we're basically seeing is that 6 months of learning loss in math and 5 months of learning loss in reading, and that Latino third graders scored 17 points lower in spring 2021 compared to 19, right? So we are seeing the college loss, we're seeing educational loss, that we have so much to make up for in terms of education recovery for our children in K to 12. This is going to translate into 2% less lifetime earnings if we don't have this recovery. This is not just a loss for today and tomorrow, but it's going to impact their economic mobility for the future. We know that over nearly 2/3 of Latino families have less than $400 in savings to weather this crisis, and that those that have lost jobs are going to continue to be economically challenged. We know that Latinos in the labor force declined from 71 to 67%. This is a 4-point loss of Latinos participating in the labor force. Lost income to their households, to their families, inability to be able to provide, to put food for their children on the table. We're very concerned about homelessness. And even though we know that there's a lot of resources out there for mortgage and rental recovery, because of the economic crisis, because of the things that we're seeing, we're going to see more of our families doubling up and tripling up in households and living in overcrowded conditions. And then, of course, we know that with all of these lost lives, there is grief, there is pain, and that we must invest in our mental health resources for the children who have lost parents, for the spouses who have lost their spouse, and literally for our community as that pain of these lost lives continues to reverberate. And finally, I want to end by just saying, as we look, this is not a one-time crisis. Everything that I've just outlined is going to continue to reverberate for years to come, so that we must fix what COVID broke when we look at where we were at pre-pandemic on all these indicators and where we're at post-pandemic. The Latino Policy Forum is going to continue to work on that, and we'll have a forthcoming report that will outline a lot more of these indicators in more detail. But what we've done in the short term and what we're doing now, and has been said by many of our other speakers, is that we must have investment in our Black and Latino communities. To that end, the Latino Policy has formed very extensive policy memos and recommendations that were shared with the governor's office, with our Cook County government, and with our city of Chicago on what do we need to do now with the American Rescue Plan dollars. We've all heard and read in the news that there are billions of those dollars coming in to our city and to our state. And we have specific recommendations on what we need to do to address all the issues that I've delineated. How much needs to go into mental health? How much needs to go into employment training and retraining? How much needs to go into making sure that all of our children are not, have access to computers? And how do we make up for these educational losses and gains? So that will be our ongoing policy work. And really look forward to collaborating with all of you, panelists, and all of those on this call as we move those recommendations forward. Thanks.
Thank you, Sylvia Fuente. Thank you so much for that. We are going to be wrapping this up soon. We're just gonna take I'm actually gonna answer one of the questions here. Somebody asked, considering that both Latinx and Black communities have increased population outside the city of Chicago, what is being done to look at data in suburban Cook County, as well as surrounding counties? It's hard to get this data put together in a report that can be used by activists. This has been an ongoing work and struggle of Illinois Unidos, Latino Policy Forum, and the Urban League. And I think that, you know, we have to work harder to get them. No excuses. I'm not going to sit here and say, you know, it's there, it's ready. We've had great working relationships with the city of Chicago, Cook County, state of Illinois, but we have to do better. And, you know, kudos to the city. They have great folks like Margarita Reina, epidemiologist, who's constantly punching these numbers. But we do have to go back. We have great partners in Cook County, but we got to go back and ask Cook County to do better. And I think,
Yeah.
Yes, please.
I
Absolutely.
have a quick update for folks to know, because we've been working in the School of Public Health, we've been working with colleagues in suburban Cook. And, you know, one of the things that's really clear is that the city borders are very fluid. And I'm happy to announce that there is a plan over the next year to expand a lot of the work and data that are in the Chicago Health Atlas to suburban Cook. So I think that will provide a really robust set of local data at the community level for our colleagues in suburban Cook. And as Dr. Murray so eloquently notes, we need to be expanding this work beyond suburban Cook also to the other collar counties. And we'd love to be able to expand the atlas so that it's a statewide atlas. But I want folks to know that that data should be coming over the next year.
Awesome. That is great to know. I'm going to end with this question. I think I'm going to throw this to Sylvia if anybody also wants to jump in. Obviously, COVID exposed a lot of things. Like, you know, a lot of the health inequities have always been there. And Jackie Serrato asked, how do we address longstanding disinvestment in the context of public health, food deserts, healthcare deserts, pharmacy deserts?
Well, we have to address them by coming together as we're doing today. We have to address them by working together with specific public policy solutions. And there are several ways to do that. If you're not already attending Illinois Unidos meetings on a regular basis, please do so. The Latino Policy Forum has also formed the Illinois Latino Agenda, which is also looking for equitable investment across statewide for the Latino community. And the Forum's Leadership Academy, one of our initiatives this year, which brings together Black and Latino community leaders, is really going to focus on some public policy and advocacy change necessary to have equitable investment. So we also, of course, need to do that by building and strengthening relationships with our legislative leaders and governmental leaders at all levels of government. And then, as I mentioned, we have very specific concrete recommendations that we will be pursuing, and we're happy to share those recommendations, and we'll invite you to talk to your legislators at every level of government to try to make them happen.
Thank you. And Sylvia, I think everything you said is actually the perfect way, is actually how I wanted to wrap up today. So you said it all. We got to work together. We got to stay connected. I do want to acknowledge somebody who mentioned to please take into account environmental justice as we breathe toxins and particulate matters. These toxins can make COVID-19 worse. I just wanted to mention that. I want to acknowledge Alejandra Beñez, the executive director of Illinois Unidos, who is also looking at a whole bunch of this stuff and listening to this stuff and trying to connect folks. I want to end by thanking Dr. Melissa Simon, Dr. Marina Del Rios, Dr. Geraldine Luna, Dr. Wayne Giles, Dr. Damon Arnold, Karen Freeman-Wilson, and Sylvia Puente. Un gran abrazo. This is really important information. And, you know, there's a lot of work to do. And so we hope we can take this information. You know, you can always contact the folks at Chicago Urban League, Latino Policy Forum. You can go to illinoisunidos.com. Abrazos, everyone. And the fight continues. Pa'lante. Thank you, everyone.
Thank you.